Hello, everyone, and welcome to a breastfeeding class presented by the Breastfeeding Clinic in the Helderberg Basin, Cape Town, South Africa. Just a quick disclaimer. The information provided in this program is to assist you in exploring all available options, to empower you to make well-informed decisions, to help you feel in control, be responsible for, and have confidence in your choices. Information should please not be substituted for the diagnosis and treatment of any medical condition, and please never disregard professional medical advice or delay in seeking it because of something that you have received in this program. And this recording is not intended to replace professional or medical or other kinds of advice. Now, in this recording, we will be looking at baby's attachment to the breast. I have highlighted it for you on the list of topics that we are covering in this breastfeeding class series. Now, attachment is considered to be the most important factor for preventing early problems. And you might remember this slide from a previous recording. Positioning influences the way the baby attaches, which influences the way the baby suckles, which influences the effectiveness and comfort of milk transfer, so how much milk the baby gets with what degree of effort. Now, for breastfeeding to be biologically successful, it is essential that the baby removes adequate amount of milk from the breast to ensure both that the baby is getting enough to grow as expected and that the breast is stimulated enough to continue milk production or to continue producing milk. Now, this slide shows how a baby takes the breast into the mouth to suckle. Now, the baby has taken much of the areola and the underlying tissue into the mouth, and the baby has stretched the breast tissue out to form a long teat in the baby's mouth. Now, the nipple forms about only 1/3 of the teat, and the other 2/3 are breast tissue. So, baby is suckling from the breast, not the nipple. This is why it's called breastfeeding and not nipple feeding. And notice the position of the baby's tongue. Just follow the red arrow. The baby's tongue is forward over the lower gums and beneath the breast. The baby's tongue is cupped around a teat of breast tissue, and you may sometimes see the tip of a baby's tongue when you observe a baby at the breast. If the baby takes the breast into the mouth in this way, then the baby is usually deeply attached on the breast. Now, to help you understand a deep latch, try this with me. Put your index finger in your mouth and close your lips on the first knuckle, and then begin sucking on your finger. Feel how your tongue flattens your fingertip up to the roof of your mouth, and feel how your lips close around your finger very tightly. Also feel the strength of your jaw and how you may use more of your cheek muscles to suck, and your teeth might also make contact with your finger. Now, give quick, short, small sucks, like this simulates the way a baby sucks when the baby is latched shallowly and ineffectively on the breast. Now close your finger on in your mouth, or put your finger in your mouth to the second knuckle. And notice that the tip of your finger is almost touching the back of your soft palate. And then begin sucking and feel the motion of your tongue, which is now elongated and curved around your finger. Feel how your tongue is massaging your finger. And feel the way your lips are slightly open and completely relaxed. And also feel the way your jaw is now more open and relaxed, and the way your teeth on your finger are now barely touching or not at all. And then give slow, deep sucks, about one per second. And this sucking approximates the way a baby sucks when the baby is latched deeply and effectively on the breast. And when the baby is attached deeply on the breast, then the nipple is in the comfort zone, way back up against the palate, where there is no abrasion or friction or damage. And when a baby suckles in this way, the mouth and tongue does not rub the skin of the nipple, which could make the nipple sore. Now here you see two pictures. Picture one is a baby who is attached deeply onto the breast, and picture two is a baby suckling in a different way. Let's focus on what's happening inside the baby's mouth. Now, the most important difference in picture two is that only the nipple is in the baby's mouth, not the underlying breast tissue. And the larger ducts are outside the baby's mouth, where the tongue cannot reach them. And also the baby's tongue is back inside the mouth and not pressing against the larger ducts. So the baby in picture two is attached shallowly. The baby is nipple sucking and not suckling effectively to get the milk easily. In picture one, the baby is attached deeply, and this baby can effectively and easily get milk. Now, the next two pictures show what you can see from the outside. Now, what differences do you notice between picture one and two? Picture one, the baby is deeply attached, and in picture two, the baby is shallowly attached. So, again, picture one, the four key signs showing effective and deep attachment are: you can see more areola above baby's mouth than below. Now, this is depending on areolar size, because a mother may have a very small areola, which is then completely covered by the baby's mouth. Or if the mother has a very large areola, one can always see some areola outside, though we want to see more above baby's mouth than below. Anyway, we also want to see that baby's mouth is wide open. We want to see the lower lip turned out, and we want to see the chin touching the breast. And we don't really want to see baby's mouth corners. We want to see baby's cheek and chin buried in the breast. And then when the baby is effectively attached, it's usually comfortable and painless for the mother, and the baby can suckle effectively. Because a bigger bite means more breast tissue in the baby's mouth, means a stronger vacuum, and the baby can take the milk out of the breast more effectively. Now, here in picture two, we see shallow attachment. So we see much less areola above baby's mouth. Maybe you'll see equal amounts above and below. The baby's mouth might not be wide open. The lower lip might be pointing forward or even turned in, and then the chin is away from the breast. So these signs are some signs of shallow attachment. And if the mother feels discomfort, that might also be a sign of ineffective attachment. Now, in this slide, which seems more comfortable? The baby's on the left or on the right? Now, again, we only want to see round cheeks on a round breast and the baby's chin buried in the breast, with the baby's head tilted back and the nose not buried in the breast. So also, if a mother needs to make space for the baby's nose with her finger on her breast, if the baby's nose is buried in the breast, that baby is overshooting the nipple, and he might have his chin on his chest. His chin might also be away from the breast. With your chin on your chest, you can't open your mouth, and the nipple is not aiming towards the palate, it's more centered in the mouth, and that might also be hurting the mother's nipple. So what we want to see is we want to see the lower half of baby's face buried in the breast. So, and also both cheeks touching the breast. And we only want to see round breast and round cheeks when breastfeeding. We don't want to see any mouth corners. And the two cheeks are also symmetrically buried in the breast. Now, if a baby is feeding like this and it's comfortable, then great. But if the feeding is uncomfortable, try pulling the baby's bum closer to your body. This will tilt baby's head back. And this will cause the baby's chin to come closer to the breast and the nipple to be more against the palate. So you can find the comfort zone in your mouth. If you can do this with me, just run your tongue along the roof of your mouth. Put your tongue behind your front teeth and run it along your palate or roof of your mouth. And as you do this, you will notice that the section of your palate nearest your front teeth is rigid and bumpy. And keep running your tongue back. You'll feel after the bumpy area, it becomes more smooth. This is your hard palate. And as you continue to move back past the smooth area nearer to your throat, you will notice that the roof of your mouth becomes soft way at the back. That's the comfort zone. So the comfort zone is near the area in your mouth where the palate turns from hard to soft. So if a mother's nipple extends to the comfort zone in the baby's mouth, breastfeeding is going to be comfortable and the nipple is going to be protected, because in the comfort zone, there's no abrasion or friction or shaving or compression. Okay, so to achieve this, we want the baby to be latched asymmetrically, because this is going to bring the nipple to the comfort zone, way back in the palate, where there's no abrasion or friction. So you can just have a look at the recordings on positioning to notice this again. Um, if you can remember, we want to make sure that the baby's ear, shoulder, and hip is in a straight line, that the baby is held close, that the baby's body is supported, and that the baby is facing the breast with the nose to the nipple, aiming towards baby's palate. When there's a symmetrical latch, like the baby on the right side of the slide, um, that nipple gets trapped between the strong muscles of the tongue and the hard bone of the palate, like jamming your finger in the door. But we will look at how to remedy this in a later recording on troubleshooting. So this is what we want to see. Okay, so remember, for positioning, we have these four key points. We want the baby in line, close, supported, and facing. And for effective attachment, we want to see more areola visible above baby's lip than below. We want to see baby's mouth wide open. We want to see the lower lip turned out, not the upper lip. The upper lip is just resting on the breast, helping to create a seal. And we also want to see baby's chin touching the breast. Now, if a baby is attached shallowly or only suck on the nipple, it might be painful for the mother. It might cause sore nipples. Because, as I mentioned, as the baby sucks with a shallow attachment, the nipple gets trapped between the strong muscles of the tongue and the hard bone of the palate. So the nipple might be misshapen as it comes out of the baby's mouth, which we don't want to see. So if the baby continues to suck in this way, that can cause damage to the mother's nipple skin and cause things like cracks and blisters, or even shave off the top of the nipple. Also, if the baby who is attached shallowly doesn't remove milk effectively, the breast might become engorged or develop lumps and blocked ducts, which might lead to mastitis if it's not treated. And because the baby is not getting enough breast milk, the baby might be unsatisfied and cry. And that's, yeah, if the baby might be feeding for a very long time at each feed and get frustrated and have difficulty, and because the baby is not removing the milk effectively, eventually, because of the feedback inhibitor lactation, the breast might start making less milk. And now, because the baby is getting less, the baby might fail to gain weight, and the mother might feel like breastfeeding, that she's failing breastfeeding. So, how do we remedy this? First of all, we check the positioning and attachment. Now, I have said this before, that with any issues, whether it is with the breast, like engorgement or mastitis, or with the nipple, like nipple pain and cracks, or with the mother's milk supply, or the baby's weight gain, or the baby's behavior, the very first thing that we can do is look at positioning in latch, because more often than not, that is the cause of the problem. Okay, so just a quick summary of what we have learned today. For deep attachment and comfortable latch for breastfeeding, make sure that we can see more areola visible above baby's top lip than below, that the baby's mouth is wide open, that the lower lip is turned out, and the baby's chin is touching the breast. Thank you so much for watching this recording. In the next recording, we will be looking at babies suckling. And please visit the Breastfeeding Clinic at www.breastfeedingsa.co.za if you want to book a private consultation and receive the class notes. And you can also navigate the class recordings easier from the website. And feel free to subscribe to this channel for more breastfeeding class recordings. And take care till next time.